Okay, imagine this. A medical procedure, right, costs almost $900,000 in just the first year. Now, picture a different patient, a totally different approach. Costs way, way less, and it might actually stop them needing that super expensive procedure in the first place. What if doing the really costly thing sometimes actually saves money down the line? It sounds weird, I know. All right, let's dig into this. This deep dive is all about abdominal organ transplants. So we're talking kidneys, livers, pancreas, sometimes even several organs together. And the main thing we're looking at today, based on the materials you sent over, is this split between what's called reactive care, basically, treating organ failure after it happens, like with a transplant or dialysis,
Okay.
versus preventative care. That's all about trying to stop or at least slow down organ failure from ever getting that bad. So our mission here is to really unpack the whole situation in the U.S., the massive burden of organ failure. We'll compare the costs, direct and indirect, for both reactive and preventative strategies. We'll look at how things have changed over time and try to figure out what a truly balanced approach to managing organ disease actually looks like. And just so you know, everything we're discussing today comes straight from the sources provided for this deep dive. Okay, let's start with just how big this problem is. The numbers around end-stage organ disease. Honestly, they're pretty shocking. Take kidney disease, end-stage renal disease, or ESRD. Only about 1% of Medicare patients have it right, but they account for almost 7%, 6.8% to be exact, of total Medicare spending. That's huge. In 2019, Medicare spent $37.3 billion just on ESRD treatments, dialysis, or transplants. And that doesn't even include the $87.2 billion they spent on people with earlier stages of chronic kidney disease, CKD. Think about this. Every single day in the U.S., about 360 people start treatment for kidney failure. Every single day. And it's not just kidneys. Chronic liver disease, cirrhosis. There are major causes of death and disability, too. High cost, lower quality of life. It's a tough reality for a lot of people.
You really nailed it there. That huge burden, it feeds directly into this constantly rising demand for transplants, a demand we often just can't meet. I mean, look at the numbers. Kidney transplants went from around 17,000 a year back in 2010 to over 25,000 in 2022. That was a record. Liver transplants saw a similar jump, maybe 6,000 to over 8,000 a year in that same time frame. But even with, better ways to manage donors and policy changes trying to get more organs, availability is still a massive bottleneck. We've got over 100,000 Americans on waiting lists right now. And the really grim part, about 20 people die every day waiting for an organ.
20 people a day. Wow.
Yeah. It just starkly shows, doesn't it? We absolutely need reactive care like transplants. They're lifesavers. But it also screams out for better preventative strategies to stop people getting to that point.
Okay, so given that rising demand, let's talk money. What do these transplants actually cost? Because, yeah, they save lives, but the direct price tag is, well, substantial. You got the surgery itself, right?
Yeah.
Often a stay in the ICU, fetching the organ, the doctor's fees, and those immunosuppressant drugs patients need, basically forever. They're incredibly expensive.
Yeah.
Our sources gave some first-year average bill charges from around 2020. Pretty eye-opening. A kidney transplant averages about $442,500.
Yeah.
And that includes getting the organ, the hospital time, follow-up, the first 6 months of those critical drugs.
Covers that initial intensive period.
Then the liver transplant.
Yeah.
This one jumps way up. Nearly $878,400. Just think about that. Nearly $900,000 for the first year.
The complexity is higher, definitely. Hospital and surgical charges alone are almost $500,000 there.
Right. A pancreas transplant is around $408,800. If someone needs both a kidney and pancreas, it's called an SPK transplant, you're looking at about $713,800. And then there are the really complex ones, multivisceral, multi-organ transplants. An intestinal transplant alone is over $1.1 million. A full multivisceral one can top $2.1 million. Just staggering figures.
And it's crucial to remember this isn't just a one-time cost. Patients need lifelong follow-up, lifelong meds, those immunosuppressants, easily over $2,500 a month. So that's, $30,000 a year, every year.
Wow.
But here's where it gets really interesting, almost counterintuitive based on the data. For kidney transplants specifically, despite that huge initial cost, it can actually save the healthcare system money in the long run compared to keeping someone on dialysis indefinitely.
Save money. How does that work?
Well, think about it. The annual cost for Medicare for a dialysis patient is roughly $91,000. But for a patient with a working kidney transplant, that yearly cost drops to about $37,000.
Okay, that's a big difference.
It is. So by the third year after the transplant, each kidney transplant is estimated to save Medicare around $55,000 per patient per year, compared to if they'd stayed on dialysis.
$55,000 saved per patient per year. That's huge, expert. So if kidney transplants are actually saving money compared to dialysis long term, Why is the total amount spent on transplants still climbing? Is it just more people getting them, or?
That's a great question. And yeah, the data points to exactly that. Even with those per-patient savings, the overall spending keeps going up. A big part of it is simply volume more transplants are being done. And inflation plays a role, too. Costs just go up over time. Like a pancreas transplant cost about $275,000 back in 2008. By 2020, it was closer to $409,000. And remember who pays for a lot of this? Government programs, institutional payers, which at the end of the day means taxpayers like you. For diabetes, for instance, which drives a lot of organ failure, something like 67% of the medical costs end up being paid by government insurance.
Right, so these direct medical bills are just astronomical. But they're only part of the picture, aren't they? Because the sources also talk about this whole other layer of costs. The sort of hidden toll, the indirect costs of organ failure.
Exactly. Huge impact there.
We're talking lost productivity, people being unable to work, disability, and the massive strain on caregivers, too. I mean, think about it. Patients with severe kidney or liver failure, often they just can't work full-time or sometimes not at all. The data showed that way back in 1994, just people not being able to work because of kidney failure cost the U.S. economy about $665 million in lost productivity.
And the ESRD population has basically doubled since then.
So that number's likely over $1 billion today, easily. Studies consistently show really low employment rates. Like only 20% of patients are still working when they start dialysis. Now, it does get better after a transplant, but it's still not great. Maybe 40% of kidney transplant recipients work, compared to like 19% on dialysis.
And compare that to the general population employment rate, around 67%. Big gap.
Yeah. And it seems like home dialysis or getting a transplant helps your chances of working. But even then, we're still only talking 45% employment post-transplant.
Yeah.
Still a lot of people unable to work.
And it's a similar story for liver failure. Really severe impact on work. Pre-transplant unemployment rates can be anywhere from 44% up to 80%. Even after a successful liver transplant, getting back to work isn't guaranteed. One study found 73% of liver transplant recipients were still unemployed shortly after their surgeries.
73%, wow.
Yeah. And then think about the caregivers. Another study found 26% of caregivers for liver disease patients had to cut back their own income or even quit their jobs entirely.
That's a huge ripple effect.
It is. And zooming out, think about diabetes, a major cause of kidney and pancreas failure. The estimated cost in the U.S. just from reduced productivity, people missing work, disability, dying early, it was $90 billion per year. So it just hammers home the point. Any prevention that delays or stops organ failure, it doesn't just save healthcare dollars, it has enormous societal benefits by keeping people working, participating in life.
Okay, let's take a look back then. Where have preventative efforts actually worked? Or maybe where haven't they quite hit the mark? With kidney disease, you mentioned the 90s and 2000s saw this big rise linked to diabetes and hypertension, right? And Medicare costs for ESRD just ballooned, $37 billion by 2019.
That's right. But we have seen some, let's call them modest improvements since around 2010. The rate of new ESRD cases, the incidence, actually leveled off or even dipped a bit in some groups. That's partly down to better blood pressure control, wider use of medications like ACE inhibitors, and newer drugs like SGLT2 inhibitors that specifically help slow down kidney disease progression.
So medical advancements are helping.
Definitely. And kidney transplants also became more common, up 33% between 2010 and 2020, partly thanks to policy changes. But and it's a big but, the total number of people living on dialysis is still incredibly high, around 558,000 back in 2019. So progress, yes, but the overall challenge remains enormous.
Now, liver disease, that sounds like a totally different story, with the causes shifting dramatically. For ages, hepatitis C, HCV, was the main driver for cirrhosis and liver transplants.
Yeah, and that's where we see a real game-changer story in prevention. The arrival of direct-acting antivirals, DAAs, around 2014 was huge.
Yeah.
These drugs cure hepatitis C in over 95% of people. It's been a massive preventative success.
Cure it completely.
Pretty much, yeah. Cure rates are incredibly high. And while they were super expensive at first, like $80,000.
I remember hearing about that sticker shock.
Right. But the cost has come down a lot, maybe $20,000 to $30,000 now. And the impact, it's undeniable. Fewer people need liver transplants because of hep C. Listings for HCV cirrhosis drop significantly. It's no longer the top reason for transplants.
Okay, that sounds amazing. A real win for prevention. But wait, you said earlier overall liver transplants increase. How does that work?
Ah, yes. It's like plugging one hole in the dam while another springs a leak, or maybe 2 weeks. Because just as hep C started declining as a cause, other things surged. Specifically, non-alcoholic steatohepatitis, or NASH.
That's the fatty liver disease, right? Linked
Right.
to obesity, diabetes.
Exactly. That and alcohol-related liver disease are now the fastest growing reasons people need a liver transplant. NASH-related transplants went up almost tenfold between 2002 and 2018. By 2019, it was the #2 cause for non-cancer liver transplants, about 28% of cases. #1, alcoholic liver disease at 38%.
So the lifestyle-related causes are taking over.
Largely, yes. So even with the huge success against Hep C, the total number of liver transplants still went up substantially, about 58% between 2010 and 2020. It shows that prevention hasn't yet been able to counter the rising tide of liver disease from obesity and alcohol issues. One battle won, but new fronts opened up.
And briefly, what about pancreas and those super complex multivisceral transplants?
Pancreas transplant numbers actually peaked back in the early 2000s. They declined for a while, partly because insulin pumps and management got better, and there were some concerns about the surgical risks, but they're still a really important option for certain patients, multivisceral transplants. Very rare, but the numbers have crept up a bit. And like you said, the costs are just extreme, $1–2 million. But even for these really complex, rare cases, there have been some wins on the prevention or alternative therapy side. There are innovative drugs like teduglutide for short bowel syndrome and really careful management with home IV nutrition HPN. These have helped many patients delay or sometimes even avoid needing an intestine transplant altogether.
So alternatives are making a difference.
They are. And interestingly, while intestine transplant's incredibly expensive upfront, it can actually become cost-effective compared to staying on HPN long-term. HPN can cost $100,000 to $200,000 a year. The data suggests the transplant pays for itself, relatively speaking, by year 4 or 5 in adults. So even here, there's this complex calculation involving prevention, alternatives, and the timing of reactive care.
Okay, so let's circle back to the sheer power of prevention itself. What does this all really tell us about the benefits? Our sources talk about different levels, right? Like primary prevention, stopping disease before organs get damaged. Think Hep B shots, public health pushes on alcohol or obesity.
Right. Stop it at the source.
And secondary prevention, catching things early and managing them to slow it down, like screening for kidney disease or treating Hep C early with those DAA drugs. And finally, tertiary prevention, managing existing organ failure to try and put off a transplant, like using the best heart failure treatments.
Exactly. And the evidence is clear. Investing in prevention saves money down the road. The CDC hammers this point, preventing chronic conditions like diabetes, hypertension, slowing kidney disease progression. It cuts costs. Big time. We know systematic screening for CKD is cost-effective. And look at the big diabetes trial, the DCCT. It showed that really tight glucose control for type 1 diabetics, that's a preventative strategy, costs more upfront, about $127,000 extra per patient over 30 years. But it prevented about $91,000 in costs from complications, less kidney damage, less eye problems, less nerve damage. And critically, it added years of quality life. So the extra cost almost paid for itself just in averted complications, let alone the quality of life gains.
That's incredibly compelling. Makes the upfront investment look pretty smart. And just to hit that HCV point again, treating it early, even when it costs more, stops all those later costs from cirrhosis, liver cancer, maybe transplant.
Precisely. Every liver transplant you avoid saves hundreds of thousands of dollars, plus it frees up a scarce organ for someone who desperately needs it right now. And maybe even more importantly, prevention leads to better outcomes in ways that reactive care, even successful reactive care, just can't fully match. Think about it. Someone who never gets kidney failure, their life expectancy is basically normal. Someone who gets a successful kidney transplant, that's amazing, life-saving. But they still face lifelong immunosuppression, higher infection risks, maybe slightly shorter lifespan overall.
So survival is good, but not quite the same as never being sick.
Exactly. 5-year survival after a kidney transplant is good, about 86%. Liver transplant, maybe 75%. Much, much better than the alternative, obviously. But prevention means you avoid that extra risk entirely. And quality of life, it's just invariably higher if you avoid organ failure in the first place. Prevention spares people the physical and emotional trauma of organ failure, major surgery, the whole ordeal.
Yeah, it seems really clear that these aren't opposing forces. Reactive and preventative care, they have to work together, right? They're complementary. Because even with the absolute best prevention efforts, some people will still develop organ failure. And for them, Treatments like transplants are absolutely vital, and like you showed with kidney transplants versus dialysis, sometimes that reactive care can actually be the more cost-effective route long-term.
Totally agree. They have to be partners. And sometimes you can even be proactively reactive, if that makes sense.
Proactively reactive, how so?
Well, like doing a kidney transplant before someone needs dialysis, a preemptive transplant, that can stop them getting sicker on dialysis, avoid those high dialysis costs, and actually lead to better survival and lower overall costs in the long run.
So timing the reactive care is key too.
Exactly. Or getting someone with sudden severe liver failure transplanted quickly that prevents certain death. And referring patients for transplant evaluation early before they get too sick means the transplant is more likely to succeed and might even cost less because they avoid prolonged, complicated hospital stays beforehand. It really shows that intervening smartly, even reactively, improves outcomes and can help manage costs.
Okay, so let's try and wrap this all up. Reactive care for organ failure, like transplants, immense cost, huge financial burden, yes. Direct costs in the hundreds of thousands, even millions, plus those big indirect costs, lost work, disability. But it provides incredible life-saving value, no question. At the same time, preventative care through public health, early detection, managing disease as well, using treatments like the Hep C cure has clearly shown it can bend these cost curves. It reduces how many people get sick, how severe it gets, and fundamentally it leads to better long-term health, less trauma, and just a higher quality of life overall.
Which really brings us to the core issue for healthcare strategy moving forward, doesn't it? A truly balanced approach has to prioritize prevention. That means real investment in chronic disease programs, in screening, in early treatment. But you can't neglect the reactive side either. You still need strong transplant centers, strong organ donation systems. What the last few decades really teach us is that, well, every infection we cure early, every blood sugar we help someone control, every risk factor we manage, that translates directly into lives saved and dollars saved down the line.
Makes sense.
Because if we don't emphasize prevention enough, the healthcare system just keeps paying more and more to react to the consequences, expensive surgeries, lifelong dialysis, managing complications. It's just not sustainable.
Right.
So the best path forward really marries the two. Use prevention aggressively to shrink the problem of organ failure as much as possible, and then deploy transplants and other reactive treatments efficiently and effectively for those who still need them. That's how you improve overall health outcomes and contain costs for individuals and for society as a whole.
Well, we hope this deep dive has given you a clearer picture of this really complex dance between reactive and preventative care, specifically in organ transplantation. Maybe it gets you thinking about how this balance plays out in other parts of healthcare too. Hopefully, it's deepened your understanding of where these huge healthcare costs come from and what truly impacts patient outcomes. Thanks for joining us.